Doctors of Reddit, what happened when you diagnosed a COVID-19 denier with COVID-19? Obligatory, not a doctor, but I am an ER nurse. We had a guy come in with what he thought was bronchitis. Asked for the test just to calm his family down. His chest x-ray showed COVID pneumonia, and his test came back positive. First it was, I'm going to need to know my test results before I believe it. Then it was, I need to see the test results because you can say anything. He refused admission and left against medical advice, and as if trying say the most ridiculous thing he could think of, said, and I won't be telling my family because I just don't believe this. He returned 2 days later, oxygen saturation in the 70s. He spent about a week in the ICU, intubated, before dying. Not a doctor, but an EMT. We got called for someone with difficulty breathing. Arrived on scene to find 87-year-old female in tripod position, bad sign, with visibly labored respirations. Dispatch warned us of COVID symptoms, so I was in full PPE, gown, gloves, goggles, N95, and surgical mask. We assessed vitals and found her oxygen was in the low 80s, very bad sign, with respirations of 28 BPM and bilateral rales and wheezing, also very bad sign. As I'm getting vitals, my partner is asking her some questions, while one of the trainees goes to ask her daughter for a history. Patient spends the entire time yelling at us about how it's a hoax and tells me to take my mask off. We refuse, and I tell her I need the mask for my protection and we actually need her to put one on. She says like hell I'm putting one on, but she's too weak to fight us, so we put it on her anyway. She swears she does not have COVID, even though daughter says she has a recent positive test. In the ambulance, she tried to pull my mask off. I warned her if she tries that again I will restrain her. She then tries to explain to me that I'm a sheep and killing myself as she struggles to breathe. ICU/COVID ICU charge nurse here. Had a woman try leaving the ER against medical advice with COVID and was needing tons of oxygen. Our docs convinced her to get admitted. My wife was her ER nurse and brought her up to me. Patient was yelling and screaming, ripping off her mask, spitting and telling us we're all sheep between gasping for breath. Our docs told her she was close to needing to be intubated, breathing tube, and she just scoffed. We reached out to the husband, who proceeded to swear and berate us, telling us we're keeping her prisoner, no visitors in our COVID unit, and that we can do whatever we need because none of this is real and it's all for show so you guys can get paid. She gets intubated, decompensates over the next few days, and finally codes. We perform CPR, give medications, defibrillate, etc. for well over 1.5 hours before calling her time of death. The kicker was calling her husband and getting absolutely excoriated because we injected her with COVID as an experiment and killed her. He then had to be escorted out of the hospital when he came in to try getting up to the unit, without a mask, of course. This is getting exhausting. One story stands out. Last summer a guy came to the emergency department with symptoms and tested positive. He refused admission for the classic list of reasons: it's a complete hoax, and even if it's not a complete hoax it's not that big a deal, I'm strong enough, etc. Couple days later he was back in the emergency department with his mom, who he lived with and who was now also symptomatic. They were both admitted and eventually put on ventilators. Guy lived, but his mom didn't. Not a doctor but a respiratory therapist. We had a patient, a mother of 3, on FaceTime with her boyfriend denying it was real right up to the moment we intubated her. Guess who ended up with a trach/peg and never came off a ventilator till she died? The patient themselves understood and agreed to all treatment. Their son though, oh man. Calling us every single day to yell at us for testing the patient, telling us doctors that we were under the government's pocket spreading lies sponsored by the CDC. The son even demanded us to print out the patient's entire medical record to prove how we were lying. Horrible to see the awful side of humans in this pandemic. Not a doctor, but a nurse. I lost count of the number of patients I had who were COVID deniers, even right up until their last breath. During the peak in January an average shift had me spend an hour or two being cussed out by patient family members that COVID was fake, and we can't keep them from seeing their family member. Then I'd spend the shift sweating like I was in Kuwait, running around trying to keep everyone as comfortable as possible and maintaining their oxygen, and often repeatedly having to put someone's oxygen back on after they insisted they didn't need it. Multiple times I got told we had it all wrong, that it was just a cold, or that they weren't that sick and didn't need oxygen even as they ran out of breath trying to get out a single word. Being in a super red rural area, it was to be expected. We even had COVID-denying nurses for the longest time. Eventually they got the picture though and got with the program. Still, one of the worst that stuck with me wasn't the COVID-denying patient. Patient believed in COVID and was a super great person. They were old though and had a caretaker. Caretaker didn't believe in COVID and was strictly anti-mask. Upon the caretaker being diagnosed with it, they refused to wear a mask or quarantine and said it was fake. They kept taking care of the person and never told them of the diagnosis. That person wound up getting COVID and being admitted to us. My wife's a nurse, just had to deal with a patient who refused to get tested prior to her surgery, so they had to treat her like a COVID patient and needed to charge her for all the added PPE like gowns, goggles, etc. The kicker is, recovery wouldn't take her for observation while she was woken up, so the anesthesiologist needed to stay and monitor her in the room for nearly 3 hours. They are billed at $400 every 15 minutes and there is no way her insurance is going to cover the extra cost because she signed a document saying she denied a COVID test. I'm a doctor working in acute internal medicine. I've seen lots of COVID over the last 12 months, probably 300 plus cases. The one that sticks out in my mind the most was a 70-year-old lady with COPD. She refused to have a vaccine because she didn't trust it despite the fact she was eligible for one for weeks beforehand, in the UK. Subsequently caught COVID and was admitted to hospital. She repeatedly doubted this was the diagnosis. She refused to go to our COVID high dependency unit despite quite significant respiratory failure. Of course she deteriorated over a number of days to the point where she was on maximal oxygen on the ward, and at that point finally accepted treatment in the high dependency unit with high flow oxygen, although continued to doubt she had COVID. Died within 24 hours of her HDU admission, having refused to go to ICU. And of course, what did her family say? They were convinced she never had COVID and even went as far as accusing us of withholding life-saving treatment from her. Unfortunately, there's no treatment for stupidity. My worst experience was when a 2-year-old kid got diagnosed with COVID. His mother had brought him with a fever and diarrhea. The child was severely dehydrated and so we had to do a mandatory swab test since we planned to admit him. It came positive and the mother refused to admit it. We were ready to perform a repeat test and we even advised for the parents to get tested. Her defense was the child never left the house. It's just I and the father who go to work daily. The grandmother babysits while we are away. How can he even get COVID without leaving the house? She had called her husband, he came with 10 to 15 relatives in a car, they broke a few chairs and then left with the baby. We just informed about the case to the COVID control center. They just kept denying they had it, stated they had something else, and tried to leave against medical advice while on high-flow nasal cannula, which we didn't let him do because he would have died within minutes. Before he was admitted to the hospital, he was symptomatic but refused to isolate at home. He gave it to his wife who ended up in the ICU. I'm an anesthesiologist, and in our institution, we're the ones tasked with intubating COVID suspect/positive patients who would otherwise die without ventilatory support. And holy hell, there are a lot of patients who don't believe COVID is real. Most of them believe that it's just an elaborate lie that doctors use to label random patients to mooch money off them. Some of them scream at us, in whatever capacity their diseased lungs can allow them to. Some outright refuse intubation, in which case they die several hours later from respiratory failure. It's emotionally taxing having to face that every shift. I'm a student funeral director and I see families go to the funeral of someone who died of COVID-19 and still deny it. They started out shrieking at the doctors to change the cause of death on the death certificate. Now FEMA is helping with funeral expenses for COVID deaths. Suddenly there's changes of heart. My mom works for an OBGYN who specializes in high-risk pregnancies and births, and he was called into the hospital to check out a woman whose due date was about 2 weeks away and who was very sick. He confirmed she had COVID and admitted her to the hospital until she gave birth, but she insisted it was a hoax and ended up checking herself out against medical advice, but not before she spat in the face of the nurse, who coincidentally had just completed chemotherapy. That was near the beginning of the pandemic, and I'm so curious what happened to that lady. The nurse is okay, thank goodness. Nurse here with most of 2020 spent in COVID land. I never had anyone refuse treatment when things got serious. I know some of the doctors I worked with got yelled at, like the rest of us, but honestly that happens frequently anyway. Some denier patients lived, many of which had accepted reality by the end of their stay after seeing what we all were going through to treat them. Some died telling me I was a sheep or an idiot or a liar between gasps of air. COVID didn't care. ER doc chiming in. They told me I was wrong. Obviously, there's no way they had COVID despite coming into the ER for shortness of breath, cough, and fevers. When I mentioned that their wife who was several rooms down also had COVID, their response was, "Oh, that makes sense because she always gets sick." When I asked how it made sense that they wouldn't have COVID with the same symptoms, I was told that it was because they were overall healthy and only took their mask off to eat and drink in the casino. Not a doctor, but nurse that worked in one of our COVID ICUs. Lady was intubated, sedated, and proned, a therapy that involves lying the patient on their stomach in order to oxygenate the lung more effectively. Reserved for very sick COVID patients, the whole shebang. Miraculously she recovers and is weaned down to high-flow nasal cannula, still a fairly high oxygen requirement, but better than needing the breathing tube. This spiteful she-devil would purposely cough on us nurses as we went into her room to give med/care, simultaneously yelling that COVID isn't real, and that we gave her COVID. God, this winter sucked.